Hi everybody, it's Dr. Susan Dubé. I'm here at my office, my clinic in Port Isabel, Texas, and I wanted to take a moment to talk to you today a little bit about food sensitivity and intolerance. A little different than food allergies. Most people are familiar with that, but they may not be familiar with food sensitivity and intolerance. So this morning, I went and had some blood drawn. You can see my little band-aid there. They filled 4 vials of blood that are going to be sent off to ALCAT laboratories where the blood will be tested several times with over 200 foods and about 120 different other products, including food additives, preservatives, some herbs that perhaps I might be taking will be tested, as well as some other things to find out if my blood actually reacts to it. And I'm trying to get the lighting right so I don't look completely terrible here, but at any rate, we do this testing specifically for people who have problems. And a lot of the problems that people might have, and they don't even realize it, they keep eating the foods that they're sensitive to, and their body has a chronic inflammatory response going on that never stops. And why is this important? Most disease conditions are all caused by inflammation. If you don't reduce inflammation in the body, your body never has a chance to heal properly. So when a body doesn't heal properly, you end up with disease and dysfunction in organs and tissues. So some of the things that ALCAT Laboratories likes to tell us about, oops, trying to show you the brochure here, are your foods making you sick? And they have linked specific disorders like digestive disorders, migraine headaches, which I can totally relate to because I have suffered from migraines for the past, well, I don't want to tell you my age, but it's been a long time, over 20 years. Obesity, chronic fatigue, ADD, ADHD, aching joints, skin disorders, arthritis, and the list goes on. Not to mention autoimmune disorders. Now, I've already given a couple of blog posts and information on autoimmune disorders and how it's related to the gut lining and a condition we call leaky gut syndrome. If you have a porous or leaky gut, it doesn't matter if you're eating a plate full of broccoli and green beans and carrots. Those things are all good for you, right? Well, not necessarily, especially if you have a food sensitivity. If you have a food sensitivity to broccoli, you should not be eating broccoli. Not until that gut lining is improved and broccoli stays in the gut instead of permeates and leaks through those porous areas of the gut, getting into the bloodstream where the immune system says, hey, what is this? This doesn't belong here. And it mounts a response by producing antibodies against the food that leaked out into the bloodstream. So this creates a condition, a leaky gut syndrome condition that can be related to autoimmune disorders. And once the body finds a protein from a food, there's a condition called cellular mimicry. And if there's a protein in broccoli that matches a certain protein in your body, say the thyroid or the skin or the blood vessel walls, whatever it may be, if that protein matches closely to the food protein, then guess what? Your body is going to mount an immune response and attack your own tissues. We call that autoimmune disorder. So why is food sensitivity and food intolerance such an important test here in my office? Because a great majority of my patients have autoimmune conditions, have the onset of breakdown of the gut lining, including Crohn's disease, celiac disease, irritable bowel syndrome, chronic fatigue, fibromyalgia. All of these are related to a poor inner gut lining, and we do these tests to find out which foods are safe for them to eat, which foods that their body does not react to, so that they can bring down that inflammatory process, and then we can get to work giving them the nutrients that they need to help actually repair that gut lining and protect themselves. So it takes about 6 to 8 months to do, and once this process is done, you can start introducing foods that you were sensitive to back into your diet one at a time and testing them so that you can find out which ones you can tolerate and which ones you may just have to avoid altogether for the rest of your life. So different than food allergies, food sensitivities are latent effect, meaning you have to wait for the symptoms to actually occur, sometimes up to 72 hours after you've already eaten the food. Most people aren't this aware of what they're eating and what effect it had on the body to say, oh yeah, I think I'm allergic to bananas because I ate one 3 days ago and now I have a headache. Well, most people are not that in tune and are eating such a variety of foods that they have no clue what they may have sensitivities to. So anyway, that's why we run the food panels here, to identify your safe foods and your not so safe foods. So if anyone that you know is suffering from any autoimmune condition or digestive condition like the ones I just mentioned, or has problems with obesity, migraine headaches, ADHD, aching joints, some of the other things that I mentioned earlier, then perhaps you might want to get your blood tested and find out which foods are safe for you so that you can start eating those, bring down that inflammatory process, and heal up and seal up that leaky gut. So that's all I have for you today. If you want more information on this topic, you can visit my blog, Dr. Duvay's blog, or you can visit my website at www.duvaywellness.com. All right, you guys have a great day, and we'll talk to you again soon. All right, bye-bye.